Hello, everyone, and thank you so much for joining us today. My name is Luciano Arnold. I'm a Senior Experience Lead at Philips Experience Design, based in Cambridge, Massachusetts. And my role is to orchestrate design efforts across different projects, especially in the radiology domain, to make sure that we deliver meaningful and seamless experiences to our customers. Now I'd like to hand over to Natasha and Gabriela to also introduce themselves. Can I ask you to go first, Natasha?
Sure. Hi, everyone. My name is Natasha, and I'm an UX designer at Philips. I'm based in California, and in my role, I design the application from initial concepts through user flows and wireframes, down to prototype and specifications that lead to a more intuitive user experience. Over to you, Gab.
Hello, my name is Gabriela. I'm a usability designer at Philips Experience Design based in Pleasanton, California. And my role is to coordinate the research efforts and ensure usability practices meet quality and safety standards. Back to you, Luciano.
Thank you so much, Gabi and Natasha. Well, today we have a big responsibility here because we are actually representing a global and cross-functional team who worked really hard to bring ROCC, the Radiology Operations Command Center, to life in a record time of only 18 months from idea to market. So let's talk a little bit about the challenges that actually motivated this project. In today's healthcare landscape, all providers have to do more with less, and workforce shortages are completely straining radiology staff. Before the pandemic, diagnostic services were already burdened with high demand, short staffing, and inefficient workflows, leading to a high rate of staff stress and burnout. Just to give you an idea, 44% of technologists in the US report moderate or severe levels of job stress. In Germany, it's 97%. Yes, it's a lot. In addition to that, variability in staff expertise and procedure quality can lead to the need for repeat scans and recalls, which not only compromises the delivery of clinical care to patients, but also results in additional procedure and training costs. Speaking of training, 3 out of 5 technologists say that they would like to have more on-the-job training. But imaging procedure training, during a pandemic, it's even more difficult because it requires in-person on-site training. So it's really hard at this point. So with all that in mind, we believe it's time to rethink radiology. So how can we amplify the expertise of lead imaging technologists and have them remotely training, guiding, and assisting less experienced or specialized colleagues across different locations? So what if radiology imaging teams could access expert support for complex procedures whenever they need it? The Philips Radiology Operations Command Center, or ROCC for short, turns what if into we can by connecting radiology imaging experts at a command center with technologists across different locations for real-time, over-the-shoulder collaboration and support. Essentially, ROCC was designed to centralize, virtualize, and standardize imaging operations, helping break down communication and geographic barriers and maximizing the value of top staff. So now let's take a look at our users and see how we are actually helping them. I would like to introduce you to Michelle and John. This is Michelle. She has just celebrated 15 years of being a radiology imaging technologist. Her provider network signed up with Philips ROCC, and she's being offered the opportunity to work from the command center in Boston, Massachusetts. Today, Michelle is charge technologist for Boston and New York City operations based on her specialty in neuro and cardiac cases. It's a bright Monday morning here in Boston today, and Michelle starts her day by getting familiar with the schedule across her 2 locations. Our system uses adaptive intelligence to prioritize Michelle's workloads, identifying exams where she can make the biggest impact. Her first exam of the day is with John from the New York location. John's got only 2 years of experience and is ready to be challenged with an inpatient cardiac case. By using ROCC, Michelle and John are able to see one another, speak, and review the same radiology imaging screens concurrently. This way, Michelle coaches John through the protocol to ensure that he feels 100% confident to perform the exam. The images from the first 2 sequences look great. That means first time right with high quality. Now I would like to hand over to Natasha, who is actually going to give more details of some of the ROCC features that Michelle and John used today. Over to you, Natasha.
So let's take a look at ROCC desktop application used by Michelle. The ROCC dashboard provides experts with an at-a-glance view of the ROCC Connect imaging scanners across the organization. Each ROCC connected scanner is presented as a card that informs location within the building, modality, along with call functionalities. By clicking the web call icon, experts can remote connect with a technologist covering a remote scanner. And now let's take a look at ROCC tab application used by John. When approved by the technologist, expert users can use the editing functionality to take control of the scanner console. The ROCC tablet also provides technologists easy access to a list of contacts within the organization. It has also audio and video capabilities, allow expert user and technologists to see and speak to each other and view the same scanner console screen at the same time. So then technologists can ask questions or give expert control of the scanner for additional support. So let's talk about our design approach. ROCC is based on the Philips Design Language System, DLS for short. If you look at the image, you'll see that Philips DLS is built from the most fundamental elements up to more complex components, following an atomic design approach. As you can imagine, Philips has a huge and complex portfolio. So having a design language system helps us to build consistent and compelling experience for our users. We also use Co-Create Framework, which is essentially the Philips unique version of the design thinking. And then by combining those agnostic building blocks with users, business, and technical requirements, we can deliver modular and configurable solutions to our users. Now, I would like to hand over to Gabi, who is going to talk about our research process.
Thank you, Natasha. At Philips, we truly embrace the human-centric design approach to ensure our software and hardware are usable by the intended users and meet international usability standards. So we apply 6 mantras to drive usability research. We are not our users. So first, we need to make sure we understand our users, their tasks, and the environment they operate in. Second, involve users in our activities. We start with users' understanding, continue, and end with users' input throughout the product design and development process. We continuously refine the design based on users' feedback in an iterative process. Also, we address the whole user experience, which includes not only the ability to accomplish a task, but all users' emotions, beliefs, preferences, perceptions, physical and psychological responses, behaviors, and accomplishments that occur before, during, and after the use of the applications. And the last but not the least, collaborate with team members with multidisciplinary skills, product management, clinical, business, development, marketing, and regulatory, just to name a few. 2 main challenges we faced in the research process. The first one is the complex system and scenario we need to test to make sure it aligns with users' needs and it's safe to use. As you can see, the expert user's workstation consists of 1 monitor to display ROCC application on the left and 6 monitors to display up to 3 scanners images in real time on the right. On top of that, there are 4 cameras in the scanning room the expert user needs to monitor on their ROCC application, and 1 camera displaying the technologies they support. So our goal is to minimize the cognitive workload and maximize usability through simple and intuitive design. The second challenge I'm going to discuss today was brought by the conditions in these troubled times. All of a sudden, we had to be creative and move from the in-person interaction with users in their environment to remote interaction. Despite the limitations and disruptions posed by the situation generated by COVID-19, we were able to leverage remote collaboration and research tools like usertesting.com and continuously evaluate our digital experiences in order to improve them. So how do we make sure our applications can be used by our users to achieve their goals with effectiveness, efficiency, and satisfaction in their context of use? The answer is by applying best practices to improve usability of our applications. We conducted 3 usability evaluations in 25 sessions and more than 2,000 minutes remotely and in what we call hybrid state to collect feedback and identify and clarify use-related problems. One evaluation I will describe today was conducted in the Philips Innovation Campus, Bangalore, where participants were connected to AMR simulators recreating the imaging rooms and moderated remotely using Microsoft Teams. And this is a great example of collaboration within our team spread out on 2 continents and 2 different time zones. This simulated usability testing gave us the opportunity to observe users' workflows while executing tasks on both the tablet and desktop application. So building usable systems provides a number of benefits, including improved productivity, enhanced user well-being, avoidance of stress, and most importantly, reduced risk of harm of patients. The journey we just walked you through described our experience and work from the very early beginnings of our project to what we have built today. A journey from what you see on the left to what you see on the right. Thanks to our customers and stakeholders, we are able to improve the interface and make it usable, effective, and safe to use. Now back to you, Luciano.
Thank you so much, Gabi. Just some reflections here. So ROCC started as a venture project less than 2 years ago. And what we do in our ventures group, which is essentially, like a startup inside Philips, we pretty much identify and accelerate initiatives that have a potential market fit. And ROCC is, of course, one of those. But when we started this project, we knew we had quite a challenge ahead because, it was more than just designing an application. ROCC really represents a new way of working in radiology, which we are co-creating together with our customers and learning together with them. In addition to that, we know that on average, only 5% of the ventures actually succeed and make it to the market. So the whole project team worked really, really hard to bring this project to life. And now I would say that all those late night hours speak for themselves. After less than a year after the official market release, we already have 2 commercial customers in the US, 8 command centers installed from where radiology imaging experts are right now, as we speak, giving remote support to a number of technologists spread across 37 satellite locations, which means approximately 142 users already onboarded to ROCC as of today. Here you can see ROCC fully functioning at one of our customers, as well as some of the feedback we've been receiving. I especially like this one that says, I've been dreaming for something like this for 15 years and now it's here. When you hear something like that from a customer, I guess you have enough reasons to celebrate. And of course, let's not forget about the awards. ROCC has been recognized for its world-class user experience, receiving the IF Design Awards, IDEA, UX Design Awards, Red Dot Design Award, NASCOM Engineering and Innovation Excellence Awards, and finally, an honorable mention from Fast Company's Innovation by Design in the Health category. Well, that brings us to the end of our presentation. We really appreciate the opportunity to speak with you today. Thank you very much.
Thank you so much, Luciano, Natasha, and Gabriella, for this truly amazing story and very inspirational proposition that will really make an impact, I'm sure, on both patients and staff. Really fantastic. And I really personally like the last quote. I think making the dream of your customer come true must feel very satisfying for you as a team. So well done. My name is Colette Forma. I'm the moderator of today's Q&A session with Luciano, Natasha, and Gabriella. They're more than happy to answer all your questions. We already have one coming in, I see. So feel free to ask whatever you want to ask and pop your question into the Q&A panel. We'll look to answer as many as possible in the time frame we have. So to start, Luciano, you spoke a lot about, or maybe I should say it's obvious that ROCC is enhancing the confidence of clinicians when diagnosing and taking decisions, etc. I'm also curious to learn what this solution means for patients. Can you expand on that a little bit?
Of course, that's an excellent question. Thanks for asking that. I would say that having a central command center allows imaging providers to offer more, complex procedures at more locations, closer to where patients actually live, which means that patients would have better chances of receiving timely diagnosis and treatment wherever they are.
Thank you very much. I was looking into the other questions, so let's see what we have. So first of all, what an accomplishment. Congrats to the team, nice to know. There is a question around ROCC operators. Is it possible for them to work from home and still achieve the same results?
Yes, so we actually have two versions of the command center. And one of them is what we call ROCC Anywhere. So they can be, located at a command center as we presented, but they could also use the system from home.
That sounds good in these times. So maybe this would be a question for Natasha. What were some key challenges that the team was able to resolve by the ROCC application? You spoke about a few challenges already. Can you elaborate on that?
Yeah, I think during the COVID situation, we are very cross-function team, but working remote, it's a very challenging way of working for us.
Okay, so you say working remote was the biggest challenge in developing the solution.
Yes.
All right, good to hear. What is unique about ROCC compared to similar solutions? Someone is asking.
That's an excellent one.
Luciano.
So ROCC is actually industry's first vendor-neutral radiology operations command center, which means that we can integrate with Philips and non-Philips technologies and systems.
Super cool. Of course, 18 months from idea to market is incredibly fast, and the industry, we all know, is heavily regulated. So what did the team do to ensure safety and reliability?
Can I ask you to answer that one, Gabi?
Gabi.
Yes, of course. Of course, safety is very important for us, and it's maybe our number one goal, along with effectiveness to ensure our products are safe. We follow process at Philips to make sure the products are safe, and running usability testing and other methodology, but mainly usability testing allow us to make sure the product is safe.
Okay, thank you. Thank you. Is it possible to scale the solution to other geographies?
Yes, and we are already preparing for the international markets. So, like I said during the presentation, we currently have 2 commercial customers in the US, but we already have a few countries in Europe on the pipeline. So we are already preparing to go international.
Okay, you don't stand still, you keep running.
Yes, keep rocking.
In your presentation, Luciano, we see a big command center. Is ROCC only for large-scale hospitals and medical centers?
Yeah, so ROCC is actually suitable for small private centers, all the way up to multi-site large academic medical centers. In other words, the technology scales with the infrastructure that each client has.
All right. Another question, can you tell us a little bit more, and I think this is Gabriela, a question for you. Can you tell us a bit more about the mental load of expert users having to monitor more than one location? How does that work?
Yeah, as you can see from the presentation, the expert user is dealing with multiple things at the same time, monitoring multiple screens, and multiple technologies, providing support while being on a call with technologists and constant communication. So that might be a lot of, as you guessed, cognitive load on the user. So for that, we try to follow a few simple but very good principles in design. Create simple and intuitive design is one of them. User recognition rather than recall is another principle we apply to make sure everything almost screams at the user, and users don't spend too much time thinking on those, and avoid visual clutter, and also know the mental model of the users.
Very interesting to hear. Another question here, what are some of the challenges you face to come up with a standard set of features for ROCC? Is that Luciano?
Yeah, I can get that one. So that was part of Natasha's presentation, actually, a little bit. So ROCC is based on a modular design system. So, as you can see, we have a desktop and tablet application. So instead of looking at those applications individually, we look at, the moments of user experience. And then by designing for modularity, we can basically scale our solution and at the same time provide consistency in terms of user experience across the, both applications. So I would say that modularity is the key word here. And of course, that also helps us speed up the process from design to development, which was crucial for us to have ROCC from idea to market in 18 months only.
Okay, thank you. Luciano, another question. You spoke about the lowering the burden of clinicians, of course, in your presentation. There is a question on how much workload does this solution relieve for users, and will burnout levels will be reduced? Is there something you can tell us about that?
Yeah, that's a very interesting one. I would say that, the main mindset that we, if we think about the whole value proposition of ROCC, so instead of, expanding the radiology teams, we are actually extending them. So you can have, experts supporting more junior technologists, anytime, anywhere. And that would definitely alleviate the burden from those, more junior technologists who sometimes don't feel 100% confident to perform the exam. All that together, of course, will, give more productivity to radiology departments, but also alleviate the burden that those more junior technologists suffer because they sometimes they don't feel 100% confident to perform an exam.
Indeed, so clear. Indeed, so we started speaking about that confidence, and I think that is something that comes back every time. That will help a lot to make the burden less. You spoke about, I think that's really interesting. So you have a multidisciplinary team. It's really a team around the globe. That's also a team with a lot of different functions in it. So maybe one of you can elaborate on how you experience to work with that team. And there is a more specific question in the queue here that says, how did you collaborate with your R&D and marketing peers on this topic?
I think we can all answer that one.
Yeah, well, that would be nice. I think that would be really interesting. So maybe Luciano, you start, and then we go to Natasha and then to Gabriela.
Sounds great. Yeah, so like I said in the beginning of the presentation, we had a big responsibility because it was only the 3 of us presenting, but there's a huge team involved, who worked really hard to bring this project to life. So it's design, product management, marketing, research, many people involved, and we work in close collaboration with them. At the end, there's no design team, there's no development team, there's no marketing team, there's only one team, and everyone is going to be responsible for the outcomes. So the collaboration on this project was amazing. Very cool to hear. Natasha?
Yeah, I'd say the same. Yeah, it's a great collaboration, and being here in the West Coast in California sometimes can be very challenging because we have also people in India. So, and the time zone difference, it's something that it's very challenging. But yeah, I think all of us we try to to make this connection great, and yeah, I think it's important, the communication. We always find a way to communicate all the time in order to get to the best result.
And thanks, Gabriela.
Yeah, having multiple disciplines in the team helps tremendously, because different roles have different views and different backgrounds. And I feel like whenever all of us, we get together and we scratch our brains, I think the best comes out of it. And another thing Natasha mentioned, having teams in multiple time zones and multiple geographies, that helped us with this situation when everybody's everybody's remote. So we're able to deal with this situation very well, because we knew the drill. We already are remote. We work remote all the time. So it worked out very well.
You're used to it, but it made it a bit challenging last year, maybe. So I think it's an absolute great example of co-creation. Well done to the team. We have another question here saying, have you been considering to connect the platform to other Philips products?
Yes.
How do you see this challenge to scale?
Yeah, so we already actually working on that. I can't give many details at this point, but yeah, we are planning to have a more integrated radiology ecosystem, a suite of applications to support radiology teams, and ROCC is going to be one of the key touch points within that suite. Like Natasha said, we have a huge and very complex portfolio. So I think what we are trying to do is also to, bring things together to provide a seamless experiences to our customers when they move from one Philips application to another. So yeah, that's on the pipeline.
Yeah, that's good to hear. Looking forward to it. There is a question from Christine saying, how would this work financially? She assumes that having an expert supporting a junior radiologist makes it double the time, double the investment, basically. So how would this impact career development for radiologists? Is that something for the team to answer? Can you say something about that?
I can say a little bit. I would say that's actually the opposite, right? So it's not about more investment. So you are actually extending the expertise of your team, right? So instead of having multiple experts in multiple locations, you can have one expert in one central location, but then supporting, radiologists, more junior technologists across the satellite locations. So I would say it's actually from a financial perspective is actually the opposite.
Okay, well, that's good to hear. Let me see. Gabriella, is there anything you could say about the way you prioritized research findings along the trajectory?
Yeah, whenever we do research, we have a lot of findings. So usually this translates into design recommendations, and it's impossible to implement them all. So what we do is prioritize them together with the team. And when we prioritize these findings, we take into consideration multiple things, like the impact of the issue, the frequency, and of course, the effort from the team, the technical visibility from the team when trying to fix the problem. So it's a combination of both listening and prioritize users' needs, along with aligning with internal objectives, so business goals, and considering the technical feasibility. It's a combination of all three.
Okay, nice to hear. You mentioned the list of awards you won with this proposition. I'm sure the team is really proud of that, and you should be. Can you just give a first response on what it did to the team to win all these awards?
That was amazing.
Oh, sorry, I said maybe Gabriele, you start, and then you hand over to Natasha and Luciano.
Yeah, it's as I said, great collaboration, effort, and everybody in the team, every single person had a great contribution. And as Luciano mentioned, it's not only we are more visible as designers, but everybody had a great contribution, and I think everybody should be proud of it and really celebrate it.
Great, Natasha.
Yeah, so I would say almost the same. It's a result of our great collaboration. Yeah, all of us, we should be very proud. And we are very happy to have so many awards in one proposition. And yeah, we are very proud and happy.
Very cool. Luciano.
Yeah, pretty much the same. I think it's great to be recognized, especially when we work so hard to make things happen. So receiving those awards was of course good for the promotion of the product itself, but also to drive momentum within the team. That was really important. And I would say that all the awards are important in different ways. Like the IF awards we won in the service design category, and then the red dot was in communication design. So I guess they were all really important for us in different ways.
Yes, all adding to the success of it. I think so. The questions are not coming in anymore. So I think you've answered loads of them. What I wanted to state is that it's really cool to read that the customer that was actually thinking about this or dreaming about this solution we have in the call. So that's very nice to know. Can you press the button, Luciano, to see the QR code in your presentation? Because I think with your story, you inspired a lot of attendees potentially to to explore what it is to be one of your colleagues and work at Philips Experience Design. So if you're indeed keen to explore that, just scan the code and then you can sign up for the talent pool and see what roles we have available in the team. Having said that, I want to thank you as presenters, Gabriella, Natasha, Luciano, for sharing all your knowledge and answering all those questions, and also the attendees for being here and being proactive, asking your questions and joining in. We have many more sessions this week, 6, which is quite a lot still. So if you are interested, I'll post the link. You can still register and join the rest of the sessions. For now, we'll round it off here. Thank you very much, team. Thank you very much, attendees. It was a really engaging session. Looking forward to the next one. Bye-bye.